In this video, we're gonna talk about everything that you need to know about anxiety. Now, anxiety affects everyone in different ways. For example, going to a job interview or giving a speech on the first day of school may cause some people to fear or nervous. But if your feeling of anxiety are extreme and are interfering with your life, then you might have anxiety disorder. It is normal to feel anxious about moving to a new place, starting a new job, or taking a test. This type of anxiety is unpleasant, but it may motivate you to work harder and do a better job at your school, at your work, or whatever it is that you are planning to do. Ordinarily, anxiety is a feeling that comes and goes, but doesn't interfere with your everyday life. In that case, if an anxiety disorder, the feeling comes and goes, then it's not really an anxiety disorder because it's not lasting for too long and it's not interfering with your life. In the case of an anxiety disorder, the feeling of fear may be with you all the time, is intense, and it prevents you to be your best all the time. This type of anxiety may cause you to stop doing the thing that you enjoy. For example, it may prevent you from entering an elevator, crossing the street, going to school, going to work, or even leaving your home in an extreme cases. If left untreated, the anxiety will keep getting worse and worse and worse over time. Now, anxiety disorder are the most common form of emotional disorder and can affect anyone. But according to the American Psychiatric Association, women are more likely than men to receive diagnosis of an anxiety disorder. Anxiety is a vital part of several different disorders. Panic disorder. This means that you're experiencing panic attack at unexpected times. We have phobia. This is an excessive fear of a specific object, situation, or activity. We also have social anxiety disorder. This is an extreme fear of being judged by others in social situations. Obsessive compulsive disorder. This means you have recurring irrational thoughts that lead you to perform specific repeated behavior. Separation anxiety disorder. This means you have a fear of being away from home or your loved one. Illness anxiety disorder. This is an anxiety about your health, formerly called hypochondria. In addition, a number of mental health and medical conditions may feature anxiety as a symptom. These include post-traumatic disorder, or also known as PTSD. This is an anxiety following a traumatic event. Major depressive disorder. A strong relation exists between depression and anxiety. Chronic diseases. Managing conditions such as chronic obstructive pulmonary disease or COPD and diabetes may result in anxiety symptom. Inflammatory condition. Anxiety can lead to chronic inflammation and diseases such as arthritis. Substance use disorder, believe it or not. Many people with anxiety may try to self-medicate to help manage their symptoms. Now, what are the symptoms of anxiety? Anxiety feels different depending on the person experiencing it. Feeling can range from butterflies in your stomach to a racing heart. You might feel out of control, like there is a disconnect between your mind and your body. You may have general feeling of fear and worry, or you may fear a specific place or an event. In some cases, you may experience panic attack. Now, the source of anxiety can include anxious thoughts or beliefs that are difficult to control. Restlessness, trouble concentrating, difficulty sleeping, fatigue, irritability, unexplained aches and pains. Now, your anxiety symptom might be different from someone else. That's why it's essential to know how your anxiety can affect or is affecting you at each specific time. Read about many types of anxiety symptoms you might experience and search them. See which one you fall into. There are many categories and there is no specific way that someone can truly say if your anxiety is related to one thing or another. A panic attack is a feeling of intense fear that comes suddenly and peaks within 10 to 20 minutes. The initial trigger of the fear can be known, or even in some cases it can be unknown. Now, the physical symptoms can mimic a heart attack, Once you're experiencing a panic attack, the symptoms may get worse if you believe you may be having a heart attack or having a mental health emergency, or negatively seen if you're having an attack in a public. So it all depends on person to person. But panic attack can vary greatly and symptoms may differ among individuals. In addition, the many symptoms of anxiety don't happen to everyone, and the symptoms of panic attack also don't happen to everyone, so it's very specific and they can change over time. Now, when you are experiencing repeated panic or anxiety attacks, you may have panic disorder. Now, experts aren't sure of the exact cause of our anxiety, but it's likely that the combination of factors play a role in anxiety formulating. A single test can't really diagnose anxiety. Instead, an anxiety diagnosis requires a lengthy process of physical examination, mental health tests, and psychological questionnaires. Some doctors or healthcare professionals may conduct a physical exam, including blood or urine tests, to rule out underlying medical condition that could contribute to the symptoms you are experiencing. Now, once you receive a diagnosis of anxiety, you can explore treatment options with your doctor or with your therapist. But treatment can help you overcome symptoms and lead to a more manageable day-to-day life. Treatment for anxiety falls into 3 categories. The first one is psychotherapy. Therapy can include cognitive behavior therapy and exposure response prevention. Complemental health techniques, mindfulness, yoga, and self-management strategies such as stress management are ways to treat your anxiety using alternative methods. Doctors prescribe anti-anxiety and antidepressant drugs. Meeting with a therapist or psychologist can help you learn tools to help you use and strategize ways that you can better cope with your stress and your anxiety when it occurs. Some other commonly used medication include selective serotonin uptake inhibitors, or also known as SSRIs. Now, natural remedies for use for anxiety are the best type to relieve your anxiety disorder. Now, these include lifestyle changes that can effectively relieve some of your stress and anxiety you might be having to better cope with everyday tasks and everyday life. Most natural remedies consist of caring for your body and practicing in a healthy way to treat your body as a temple while eliminating unhealthy ones. These include getting enough sleep, meditation, staying active, exercising, eating healthy diet, avoiding alcohol, avoiding caffeine, avoiding nicotine, cigarettes if you smoke. All of these things are lifestyle changes seem to have a positive way of effect in eliminating some anxiety. If you have anxiety disorder, you may also be experiencing depression. While anxiety and depression can occur separately, it's not unusual for mental health disorder to happen together and have these things kind of combined. Now, anxiety can be a symptom of clinical major depressive disorder or depression. Likewise, worsening symptoms of depression can become triggered by an anxiety disorder, so they can work hand in hand. You can manage symptoms of both conditions with many of the same treatment, psychotherapy, counseling, medication, lifestyle changes, and natural responses that you can do to your body to change your day-to-day activity. Stress and anxiety are related but are completely different. Stress is a typical and healthy reaction to an undefinable or event making you nervous, such as upcoming tests, presentation, wedding, or other major changes in your life. Stress will go away once the trigger goes away. When you're experiencing symptoms of anxiety, they can manifest as a physical symptoms such as dizziness, tiredness, muscle ache, tension, shaking, dry mouth, excessive sweating, stomach ache, headache, insomnia. But neither stress nor anxiety is always bad. Both can provide you with a boost or incentive to accomplish a task or challenge before you. But if these feelings become persistent, they can begin to interfere with your day-to-day life. In that case, it is important to get treatment as soon as possible.